So I guess we finally reached that point. State of emergency, curfews, and all that scary stuff. It was announced Saturday after some beating around the bush that, we have to have the customary beating around the bush. Our Prime Minister has that kind of fatherly finish where all the long talking might rather just beat me and done now. This entire long diatribe you're trying to hit me here, I could just take the licks and done. Start off your speech with as of midnight tonight, and we'd get the main part first, and then you could give us the talk after, so the rest of people who want to tune out could tune out. TnT under a state of emergency. PM announces curfew from 9 p.m. to 5 a.m. says don't jack bleep the thing. That now some might say is the new motto of Trinidad. There are songs being created, there are memes.
And as the Prime Minister endorsed what the Calypsonian said, don't jackass the scene.
Don't jackass. Don't jackass. Don't jackass the thing. Don't jackass the thing.
And hopefully the meme and the songs help people to actually listen and give us a ease up now, because as plenty of people keep saying, it feels like a group project where we suffering for the bad work of other people in the group. And some of that is true. Some of the suffering that we have is due to the bad work of some other people inside of the group. Hey, liking what you see? Well, like what you see. Like the video. Drop a comment, tell me what you think. Tell me what you'd like the next video to be, and tell me a good topic that you're interested in. Tell me some current news that you're hearing that sounds really interesting. Subscribe so you'd see when new videos come out, and click the notification bell so you'd know exactly when they drop also. I'm trying to do some content that's a bit different that I think I don't see much of here, and we usually complain about the level of discussion and discourse in our country, so let's elevate it together. Trinidad and Tobago is under a state of emergency. This is the last line of defense by the government as it attempts to stifle the surging COVID-19 numbers and deaths in the hope it will give the overburdened healthcare system some much needed breathing room. And lest anybody forget, that is exactly what we're aiming at. Giving the health system some breathing room. A part of the problem with that, for those of us who are clamoring for more freedom and that the government shouldn't have the authority to suspend our rights like that as free people. The problem with that is that we are in a joint healthcare system. Maybe you're a first proponent that the healthcare system be more independent and private and that everybody pays for their own healthcare. Maybe you want that, but the fact of the matter is that you're currently in a country, you were born into this country or you came across into this country, and the way our healthcare system runs is that we all are joint into it and we all pay into it and we all receive the reward of that. That is beautiful in the times when we need it, but in times like this, now we must all pay for this. So okay, you may think, well, my freedom and my health is my responsibility and I want to deal with it as I see fit. If I want to risk myself out there and allow myself the possibility of getting this disease and getting over it, well, that's my business. It may be, but it wouldn't be your business in the fact that you can create an extra weight on the healthcare system. So now we all must decide what you do with your freedom also. That's the problem when you do things together, and that's the problem when you do things as a collective. There are rewards to it. There are rewards to having a joint healthcare system where the burden on each person is spread out across the country and across the population. But the drawback of it is that in cases like this, we have to make decisions for the entire unit instead of for the one individual. The SOE comes with a 9 p.m. to 5 a.m. curfew. If you don't have to be out for exempted reasons, stay home under the force of law, Rowley said. We will do what we have to do to further minimize the opportunities for infection, and we're expecting that with a population that is now even more responsive, that this is the time to take it serious and take it personal. The Prime Minister said, contrary to what people believe, it was not feasible to simply shut down the country. Even to be home, you need people to be out, he said. Anyone who thinks that it is possible to just shut down an entire country is speaking from a place of ignorance, and they need to just try and think for a bit while they're sitting home. The conveniences they have, the services they have, the utilities they have, it doesn't run on magic. Unfortunately, we haven't reached the point of automation where everything that we need in our lives are run by robots and the robots take care of us and then we don't necessarily need to do anything. We haven't reached that point yet, and maybe for a good thing, because maybe the robots would take over. Rowley did not give a time frame for the lifting of the SOE, but indicated that the length will be determined by the response from the citizenry. None of us in this country have ever been in a state of emergency during a pandemic. Take that, use that as your guide, he said in response to questions on when the SOE would end. Now, if you're someone worried about a state abuse of power, this statement is something that will worry you, because the rights of a citizen are suspended during an SOE, and for the Prime Minister to say, well, the SOE is indeterminate, that could seem kind of scary. It seems like the power would just be in the hands of the authority for the foreseeable future, and we don't know exactly when the power would be relinquished. Now, if you're thinking about this in the terms that he said it in, as a pandemic, as a literal health emergency, it would make sense, because we don't exactly know when the pandemic numbers, when the infection numbers are going to necessarily decrease. So it doesn't make sense to say, okay, well, we're going to stop this SOE by next week, and we don't know exactly what's going to happen next week. And it doesn't make sense necessarily to say it's going to last for 3 months, when maybe the situation may be under control within the next 2 weeks. Who knows? So it does make sense when you think about it in that level of reasoning. Just weeks ago, Rowley said that an SOE and the inherent loss of constitutional rights was unnecessary. On Saturday, however, he defended the change in that stance. All of that has been solved by me using the state of emergency, which is properly ensconced in the laws of TnT, he said. I didn't want to use the provision that is existing now in the Public Health Ordinance, because not very many people give the respect to the ordinance that they give to the state of emergency. And he's right, that was a sentiment that was agreed to, in fact, by one Dr. Munilal. That would have been 9 days ago, at the same point in time when he made the now famous guinea pig statement. He himself said that one of the reasons that the citizens aren't taking these ordinances seriously is because they aren't enshrined in the law. Back then he made the statement, he's trying to control behavior, but if you really want to handle the situation properly, all you need to do is pass law for it. But he's scared to go to the parliament to do so. The reason why people aren't taking him on is that the measures aren't law passed in parliament. Well, the state of emergency is the law passed in parliament, and it now gives the state and the executionary bodies of the state, meaning the police, and, well, in a state of emergency, in this case now the regiment also has that power to arrest people, and now they have that legal power under the law to do these measures. So if some people were of the opinion that the health ordinances weren't strong legal standing enough, well, now it seems like we have enough strong legal standing for the state to do as they need to do, or as they think and see that they need to do, to get this pandemic under control. And during the rest of his speech, the Prime Minister again chided over and over in his usual slightly parental, old school, local parlance style, begging people to stay home and not rush at the groceries. And I hope that advice works, because it seems like nearly every time when something is declared closed, people think that that is the opportunity, that before midnight we must all rush and try to get there. And the sentiment was carried on by the thoracic medical director at the Cora Hospital, Dr. Michelle Trotman, and she phrased it as, and I beg the population to indeed freeze. We don't need the police, we don't need the army. You know what needs to be done, Trotman said. And that is the ideal of it, that this SOE becomes something just of a formality. We really don't want a situation where we need to test out what new abilities the police and army do have. And a lot of us are aware that our regiment, our army as some would call it, they are known for enjoying the use of their hands and batons, etc. And we don't want any incidents like that. And Dr. Trotman was basically telling us we big and we have sense, and let's try to avoid that. But even in the case of that, Omlala says TnT's vibrant democracy will prevent abuse of power under the SOE. And I am hopeful of that too. I hope he's right. Attorney Omlala believes that Trinidad and Tobago's vibrant democracy will prevent any abuse of power under the new state of emergency that has just come into effect. The suspension of rights is always something to be worried about, but states of emergencies are used in exceptional circumstances, as in this case. I don't think there's a reason to worry, because we are in a national crisis. It is a strict, harsh measure for the protection of life and liberty. The police have their jobs to do and not exceed their powers, he told the Sunday Guardian. And as pointed out by several people, a pandemic seems a measure enough for a state of emergency. I've seen many people question if other methods could have been done. and if there were ways to avoid this, and what about people who may be restricted by this, and if you need to go about in the curfew, you just need to get the special exemption to do so. You just have to write a letter requesting such and submit it into the police, and they would evaluate it and give you a permit or a pass to be around during the curfew periods. There's a point to be made about the government's ability to make precise decisions and precise moves in order to fight this pandemic. And it seems like sometimes it can seem like the government is constantly using a broad measure and using a sledgehammer to send in a tiny nail, or a sledgehammer to send in a staple in some cases. Maybe they could have done some more specific tweaks to the system to maybe allow for things to run more smoothly even during this time. But what has to be brought in mind also is that when the government gets into too specific of decisions and how many people could walk in and who could buy what, and should there be a list of things people could buy, and should the government give you a list of things you could buy when you go to the grocery, or should it be that the government controls which families can go to the grocery, and is it just families whose names end in A to N or something, they have their days on Monday and Tuesday, and okay, maybe some of these specific things could have been done, but when these things reach into the government sphere, we start to get accusations of the government micromanaging, and we don't really want the government micromanaging. So maybe a broad spectrum state of emergency can make more sense. We had unique in this, and many other places have gone down this road. What we may be more unique in is in the fact that it has taken us so long before we have reached to this point. Many other countries have reached to this. Some countries have way stranger and way more unique restrictions. France has a curfew and movement restrictions. Paris area is under a new lockdown to combat a surge of cases. Residents can go outside for exercise, but only within 10 kilometers of their homes. People are not allowed to travel to other parts of the country without proof of a valid reason, such as a death in the family or business that cannot be done remotely. Masks are required on public transportation, and on top of that, France's National Academy of Medicine has urged people to keep quiet. No talking, no phone calls, to reduce the spread of germs on public transit and whenever social distancing is not possible. Officials specify that this is not an obligation but a recommendation. So they have a shut up recommendation, and I don't disagree with this. On public transportation, I could probably agree with a shut up recommendation at all times, with or without the pandemic. We should probably keep the talk to a minimum. And this pandemic is pointing out some unsanitary things that have become kind of part of our custom, and that maybe we can do well with changing. During France's lockdown in March 2020, that was their lockdown last year, the rules were even more stringent. People had to download and fill out a form each time they needed to leave the house. So we aren't that bad yet. In Abu Dhabi, which is in the United Arab Emirates, they are tracking wristbands. Since September 2020, most passengers arriving in Abu Dhabi in the United Arab Emirates are required to wear a tracking wristband during the mandatory 10-day home quarantine. All travelers also have to undergo thermal screening and COVID-19 testing at the airport. So, yeah, your rights and your rights of movement, yeah, sure, but they're tracking you. So, you're under the 10-day quarantine, and during that 10-day quarantine, they have a tracking wristband on you so that they know your exact whereabouts. There isn't no fleeing quarantine in this case. In Singapore, they also have the tracking devices, and they have hotel quarantines. In Mexico, they have a junk food crackdown. A number of states in Mexico took steps to ban the sale and marketing of junk food and sugary drinks to minors in September, out of concern that health conditions such as diabetes and obesity were putting people at higher risk from coronavirus. The law applies to stores and school vending machines. I agree, and I've seen this point made by several other people. If the government now is telling us what we should do to remain healthy, early on in this pandemic, it has been seen that the coronavirus has been affecting people with comorbidities at a much higher rate than people without. And one of the chief comorbidities that seems like it's a real problem to get over the virus, if you have this comorbidity, is obesity. So maybe part of this lockdown measure and part of the pandemic measures should be for us to lose some weight, and possibly with the closing of the food outlets, that might be a secondary objective that might still be achieved during this pandemic. Hopefully, our entire country can come out of the pandemic jointly a little thinner and a little fitter for it. Spain has rules on gatherings, smoking, speaking, and in Spain, the regional government of Galicia in northwestern Spain announced that it has approved fines ranging from $1,100 up to $71,000 for people who refuse to get vaccinated against COVID-19 if their refusal is deemed to result in a very serious risk or harm for the health of the population. But the law is facing legal challenges and may not go into effect. What a proposal that would be. And I wonder how that would go across in a country like ours. You'd be fine if you do not take the vaccine. And that goes back to what I was speaking about in the beginning, where because of the nature of a joint health system, where we're all paying into this health system, and if it crashes, we all have a loss to take and a loss to face from it, then you could understand the point where you may be willing to fine someone if what they're doing is jeopardizing the stability of the entire health system. Germany requires special masks. They require their citizens to wear the N95 masks, the masks that do a much higher level of filtration, and they must wear these masks when they're in public places, in public transit, in workplaces, in public food places, or business places. Panama is alternating Men's and Women's Day. At the beginning of the pandemic, Panama announced one of the most aggressive measures in Latin America. Locals could only go out on alternate days according to their sex, as stated on their national identification cards. Women could only leave their homes to buy necessities on Monday, Wednesday, and Friday, while men could go on Tuesday, Thursday, and Saturday. Everyone had to stay home on Sundays. Even on their designated days, both men and women only had 2 hours to do their grocery shopping. This measure was eliminated in February. Well, things, as we see, can get more drastic. We can't possibly go to rationing men and women's days and see how that works. And a lot of these measures in different parts of the world go on into more unique and more specific ways in how they are attempting to tackle their pandemics. In our case, we have a broad state of emergency. A lot of the specifics of this state of emergency aren't fully known yet, and we don't yet know quite to what extent the state intends on suspending rights to get this under control. One thing I am sure of, though, is that we don't want to see the measures that would have to happen if this pandemic keeps getting worse. And the measures would get more severe if this pandemic gets worse. We don't know exactly what those measures would be, but I'm sure they won't be something that we'd necessarily like to see. See you in the next video.